"27 years ago, when I had my first child, and I'm a mother of 4 children, I had 4 cesarean sections. I had no idea about a doula. In 2026, I'm happy that we're able to provide doula services to women across our state, especially in a community like mine. As you know, Black maternal health, the death rate was in high numbers. Our numbers have went down, but the numbers are still high. When you have a doula by your side, they're with you before pregnancy and after pregnancy, and also able to provide emotional support, direct support to mothers who might not have someone in the household with them. And one of the greatest things is that they're able to coach mothers along the way when they're in fear or whatever it may be. They're able to be right beside them, encouraging them and coaching them along the way. When we talk about Black maternal health and Black maternal access, and we talk about doula care, it's been years that a lot of Black women in our state had no idea about doula services. And what I'm happy about is having this public awareness campaign when it comes to doula services, is that our Black women and women in our state will be able to access these services.
Welcome to Jersey Rules, where we break down the laws shaping life here in the Garden State. You just heard from Assemblywoman Speight speaking about doulas and her legislation, which is now law to expand public awareness of the benefits of doulas and midwife services. Today, we're excited to be joined by 3 guests who bring both expertise and lived experience to the conversation. Achebe is the Safer Childbirth City's Supervisor and Health Systems Liaison for Mercer County at the Children's Home Society of New Jersey, and she's a certified doula. Dees is President and CEO of the Children's Home Society of New Jersey, and Macchiaverna is a mom and real estate agent who has experienced firsthand the impact working with a doula. Thank you all for being here. Let me ask, after hearing Assemblywoman Speight talking about expanding awareness, from your perspective, why is public awareness around doulas and midwives so important?
I could go to speak to that just because that's a lot of the work that we're doing through Safer Childbirth Cities is pregnant. First of all, the rates, the maternal mortality rates in general are high, even for the United States as a country, as a nation. And people don't understand it impacts everyone regardless of socioeconomic status. Pregnancy is a life event, and that's what we're taught as doulas. And the things that come along with that really do shape eventually the outcomes for the birthing person or mother, and then eventually the child. So being able to feel supported from the minute you find out you're pregnant to getting discharged from the hospital is such a critical and important time, because it really does impact outcomes for everyone involved, including families. And being able to know that you're not doing this alone is also part of what improves these rates that we're still seeing as high.
And I think the importance of raising awareness is key, right? You could have the best service in the world, the best product in the world, but if you can't let the public know that it's available, it's completely useless. If you think of how we've been able to move the needle on a lot of really important health initiatives in our society, smoking campaigns, the importance of getting tested for it, whatever it is, it's all about awareness and letting the public know, first of all, that this is something we should pay attention to, and then helping people understand how to access it.
I only knew because I kind of advocated for myself and just took the card and took the chance at my doctor's office and didn't really know a lot about it. And they really didn't have much to tell me either. I just did the research and then decided that would be a good fit for me.
What are some misconceptions that people have about doulas and what doulas do or what they don't do?
I know actually the new one, at least what she knows what they do.
Yes, but I thought I had definitely some misconceptions.
Yeah.
I thought it was a little more, crystals and new age kind of, which is fine. That's totally cool. Yeah. But I thought it was more of something that was not more like a fringe kind of service, more than a medical standardized kind of offering, I guess.
Yeah, and I agree with that. I think people, there's sort of 2 different worlds I think that people think about as doulas. Either it's an elite service that very wealthy women can pay some high fee to get this specialized service, or it's a holistic alternative to medical care. Yeah. And it's neither of those things, right? It's really, it should be part of standard care when you're a pregnant person. And I know, Uzo, you can probably speak more to that. But
Now, Julie and Ashley touched on the main points. Our role is to be the advocate for the person. That's our main purpose, is to actually sit there and make sure that if there is question or medical jargon that's coming at you that you're not able to parse through because you're not a clinician, can we at least step in and ask the provider, can you please explain that again to my client here so they understand what their options are? Is an epidural necessary? What's Pitocin? Like all of those things, so that people feel at least confident and assured that they are part of this process, and pregnancy isn't just happening to them, right? This process isn't happening to them. They're included in the decisions.
Did you find that advocacy was like made all the difference?
Definitely. That's why I chose to use a doula the second time around. And my husband was like, you know what you're doing, you know, like how to do this. And I said, I just want everything to go, not exactly how, you know, there's changes that are necessary, but I had such a positive experience that I decided to do it all over again.
Well, you touched on it a little bit, so explaining a little more, people might not realize, like, again, where the doula is, the midwife and the doctor, and how they work together and what each one might do. Can you speak to that a little bit?
Yeah. So I think it's part of New Jersey's efforts recently, especially with the doula access bill that they passed. They made it imperative that doulas were actually included in the room as part of the care team. So your care team is comprised of all clinicians and also non-clinical professionals. So that includes obviously your providers, if that's your midwife. So you have your OBGYN who's performing the surgery as well, and then midwives that are also there that are also performing those surgical operations, and then you have the nurses that are supporting, and then you have your doulas that are there to support the actual client. The doula is there solely to support the client the whole entire step of the way. And some little things we don't even think about. Like, for example, when someone gives birth, who's going to get the water, who's going to get the snacks out of the nourishment rooms that are in the labor and delivery floor? They're there. We know where they are, right? After the doctor and the provider's done performing the surgery, they're probably doing another one. They're going room to room to room, right? And after the nurses come and checked in between that time while you're feeding and trying to get rest, like knows where to get the snacks and who knows where to get at least all the other things, or at least ask for your pads to be changed after, if you know, you need the cooling pad after you've given birth. So we know those things, those little things you don't think about, but they offer so much relief and comfort there. The whole point is that we want you to feel comfortable even after you've gone through this really strenuous and laborious process.
I think about it too also, if you think of the evolution of the doula, I really think it's going back to the way birthing used to be, and still is in many countries. The grandmother, the aunt, that is familiar with where babies are delivered in your home, right? So really, that's where you're supposed to be most comfortable. And the physicians, the clinicians, they're the outsiders coming into your space where you should be comfortable, where you should feel relaxed. And your aunt, your grandmother, your mom, they're the ones that are providing what today we're calling doulas. But this is the way it used to be. And people felt nurtured. They knew that somebody was advocating for them. That was the piece that kept the mom calm, and then that all leads to better health outcomes.
That's a great point. And you also mentioned that it benefits the child too. Can you speak to that a little bit?
We've been providing community doula services for years. In fact, we just surpassed, I think, our 600th baby. 500 in our specifically Spanish-speaking population, but all overall about a little over 600 babies that we've helped deliver. And the data speaks for itself. For our moms that get connected to doula care, they're carrying full term, the babies are born at a healthier weight. Moms are attending their prenatal, their visits that are so important, because we help moms keep up with those things because there's so much going on. And as we all know as women in our lives, that sometimes the last thing we do is take care of ourselves. And that is so critical all the time, but especially when you're also growing another human inside of you.
You're not just done after you give birth, right? So when we say supporting children, it's also making sure that we're kind of keeping track of those early milestones too. So it's an all-encompassing project or group with us here at the Children's Home Society.
That's amazing. I didn't realize it even extended that far.
We do. And we run the Mercer WIC program. And so for our moms that come in, they'll get the pregnancy testing. If they find out they're pregnant, right away we offer different sorts of counseling and services. We get them connected to WIC so they can sign up for benefits, because we want moms and families to know what are the benefits that New Jersey has to offer. And I'm not from New Jersey, so I can say what New Jersey offers is pretty stellar when it comes to, they're really paying attention to the first 5 years of life and what a difference that makes. And we're not even I mean, we're not even seeing the outcome that this is going to have. When you pay attention to those first 5 years, the real impact happens 20 years from now, when we have individuals that have been able to overcome maybe some of that intergenerational hardships, trauma, poverty, what have you. And so, investing in those first 5 years is going to pay off tenfold down the line.
So what led you to become a doula and drew you to maternal health advocacy?
Maternal health, reproductive policy, reproductive advocacy has always been a core interest of mine. Also just healthcare in general. I am the daughter of immigrants, Nigerian immigrants coming. And one of the biggest things, aside from education, that they always championed is healthcare. Like the fact that we could even just go to doctors and get checkups for everything. That was a privilege that it wasn't afforded for everyone back in Nigeria. I did a lot of that work in undergrad with Rutgers too. I decided I really wanted to work in obstetrics and gynecology one day. The opportunity to train as a doula came through First Lady Tammy Murphy's Nurture New Jersey initiative. So we were the second cohort that they were pushing out there to learn how to be doulas. It was the New Jersey Doula Learning Collaborative. And in that cohort, there was all of us from different walks of life. Everyone. We got people who were previously lawyers, previously accountants, previous teachers. I always say, start off being a doula and see how you can support people at the outpatient sites.
My whole career, I was working with adults that were experiencing homelessness, that were struggling with substance use, that were dealing with untreated mental health, that were dealing with intergenerational trauma, gun violence, all of these things. And that is important work, and people need to do it. But the aha moment was, but how do you prevent this? Children's Home Society of New Jersey is how you prevent it. It's you start from day one, right? You help children and families get on the right path so that it doesn't matter what your zip code is, it doesn't matter what your background is. If you can intervene in those first early days of a child's life, that's what's going to eventually prevent homelessness, prevent gun violence, prevent substance use.
And Ashley, you have 2 beautiful children.
I do.
And you had doula services with both children.
Yes.
Right? So, so you touched on how you first found out about doulas through the doctor's office.
Yes.
And then what was the decision process? Like once you picked up that card, was it speak to your husband, speak to the doctor? What is this about?
I was looking forward to taking her birth class. That was all I was really going to do. But then during COVID, I thought maybe my husband wouldn't be in the room with me, or it was a very uncertain time. And that week, I believe it was Tammy Murphy had the doulas being able to come back into the hospital rooms. And I said, Sue, please, please, please be there with me. She just had such a calming, knowledgeable, just everything, like a family member, but with no judgment, no bias. It was just the best of both worlds.
Let's talk a little bit about maternal health and equity. So Uzo and Julie, as you touched on, the U.S. still struggles with maternal mortality and disparities in outcomes. So in New Jersey, Bill A5739 went into effect in 2004 that provides support at every stage of childbirth. What are some of the structural barriers families face when it comes to childbirth?
The biggest thing, and Assemblywoman Speight had mentioned this too, the maternal mortality rate is abysmal, right? Black women, disproportionately, their rates are higher than any other race that we're seeing. And I think that speaks to the fact that there's just access to services isn't equitably distributed to everybody. Not everyone knows. That goes back to some of the misconceptions around care. Like, who is eligible for this care? Who can get it? What does it look like? Where's this information going to? And I think that's why when community-based organizations, even such as ours, come into the fray, we make it accessible for everyone, right? But then we also know, once we do that needs assessment for the communities that we serve, we identify those barriers, and we obviously look at who is in our community. Do we have services available in the languages that we see most predominantly in our community? Is the information in flyers, or is it also in the different languages too? Are we really reaching everyone in our area? So I think that access to information is one of the biggest barriers. And I think in regards to the rates being high, particularly for Black women, it's also not being listened to. And that's some of the biggest issues even we're seeing today. And your ability to pay for anything should not impact the type of care, the quality of care that you get. So just to champion a lot of what Assemblywoman Speight and what New Jersey is focusing on is ensuring that the barrier with race, income does not stop you from being able to support the child up to for the rest of their life after.
The disparity of outcomes for Black and brown moms, we can't dispute it. I think of developed nations, I think we rank the worst. It speaks to the systemic challenges that the United States of America continues to have in place. I think the reality is, from what the research shows, is that doctors don't necessarily listen to what a Black or brown woman says the same way they would listen to what I would say or what you would say. And that is tragic. And it's tragic. And it's leading to the disparities that we continue to see, which is why it's so critical that things like you are doing in New Jersey are so important, that access to information is so important, that the communities that we're trying to reach are also represented at the table and in the discussions and helping to craft the bills and the legislation, because who knows better than people that have experienced it.
Just like this bill that was signed into law over a year ago, how important is the legislation to getting out to people, and not just that piece of legislation, but other pieces that have to do with doula care? How important is that component?
I want to say so important. I mean, once that bill was passed and hospitals had to share their protocol on doulas in the hospital, it really did impact us being able to come in and do our job, right? Even at the Children's Home Society of New Jersey. And our partnerships were, the partnerships we were establishing with the hospital sites and the clinical settings, they were aware of this. They were aware of this mandate that required them to be able to, bring us to the table. It is so important because it allows us to do our job, and allows us to do our work without any sort of red tape and barrier, because the whole point is improving birth outcomes for the clients, right? So when we show that there's been a high need for this, and then New Jersey and our legislators are understanding the impact of it, it really helps us to expand our work, right? It's easier for us now to move to more hospital settings, more clinical sites. And I'm speaking for the clinical integration perspective of that, because I'm very passionate about making sure our information is in places. Just like Ashley was able to find doula work at her OBGYN office, I want us to be in those spaces. We're very happy that legislators are taking this on, but also including doulas at the table, right? So when I provided my testimony on the importance of doulas being in this space, and also the importance of doulas representing, adding that cultural awareness of representation, I did it because from my own experience, I knew the importance of that.
I would agree with that. And I think legislation is so important, because I feel like not only is it validating for those of us trying to do the work, it's kind of like it's great to be seen and to have people that can put laws in place to make sure things happen. It also closes the loop in ensuring our work can continue. Without legislation, we can't get Medicare to pay for the services that we need. We can't, or Medicaid to pay for the services that we need. And so it's really, it's part of a building block, right? Usually a lot of these things grow out of grassroots movement, and then it starts to gain steam. But without legislation, without those pieces being put in place, it's almost impossible to sustain it. And so that's why they're so important, because if you think about how can we keep this going, or better yet, how can we expand it and grow it and make it something that is available to every woman in every space, it's going to be because of pieces of legislation.
For someone who's listening, who's expecting a child, we spoke about what the value is of the doula, but is there anything else you want to speak to that person who's expecting?
To anyone who's expecting, they should know first and foremost, you don't have to do this alone. You never have to do this alone. There was always support, and there's a community that is willing to pour and ready to pour into you and your child's life. You don't have to you're not alone. It may sound cliche, but you really are not. There's resources also in the community that can support you and your child, so you don't ever have to go through this. Even after when you give birth beautifully, you don't have to do this alone. You're here to support you and your family.
My doula connected me with a lactation consultant afterwards when she came for my home visit to check in on me. So she definitely continued the care beyond the delivery room and before the first postpartum doctor's visit, because that kind of is a long stretch, 6 weeks. Yeah. So it was nice having that support right after.
And if somebody wanted to become a doula, where do they go? How do they start? What is the process?
So we do provide certification training courses to become a certified doula. They are free of charge. We have cohorts that are starting not continually, but on a regular cycle. There are different certification models out there. We happen to follow one called Health Connect 1, which is a real strong evidence-based kind of what we consider kind of gold standard in training. It's not for the faint of heart, because to do this work, this is serious work, right? And so our trainers, and we also do a train the trainer to help other agencies be able to train and mobilize the workforce, the doula workforce. It's such a needed non-clinical service that is a game changer for moms.
Doula training isn't necessarily regulated, but New Jersey, since New State has taken onus and wanted to really champion this doula work, they have worked with a bunch of experts on how to make sure that they're training and certifying the top of the top, cream of the crop doulas. So our agency model is under those trainings, in addition to other agency models as well, and the things that you are required after to be a Medicaid approved doula trainer. So that includes CPR and other continuing education. So there's really a lot of information on the New Jersey website as well. But doula training in general, as Julie said, you can Google that and it'll tell you where you can get trained around you.
Ashley, looking back on your experience, and you spoke to a couple of moments, but is there one particular moment having a doula made all the difference that you think people wouldn't really understand,
Giving myself the confidence to make my own decisions and really voice concerns. And I'm thinking back to, I think I went to my 40-week appointment and they said, you have to get induced tomorrow, you have to do this. She was pretty firm with that, and I just didn't feel that was necessary, and I didn't feel ready, and she kind of talked me through it. And I said, no, I don't feel ready. And then I don't think I would have voiced that to my doctor if I had not talked to her first, just because I thought, not that they scare you into following their path, but to have options. And I did a little more research, and then my daughter came 10 days later on her own, and I had her quickly, easily. I pushed one really long time, and I had her. So, it couldn't get better than that. And I feel like everybody's quick to tell you a horror story or a really long labor story or a dramatic story. And I was I had a really great story, and then I kept telling people about it, and I think a lot of it was due to Sue, my doula.
So as we look ahead, what changes would you like to see in maternal health care in New Jersey?
I would like to see higher reimbursement rates for doula care. They're woefully underpaid. We have to be able to keep our head above water and train quality doulas, pay them a living wage, because the work they do deserves more than a living wage, right?
Well, as we wrap up, I want to thank our guests, who's Julie and Ashley, for sharing your expertise, your experience, and for such an honest and very important conversation. Thank you so much.
Thank you so much for having us.
Thank you so much for having us.
Thank you.
You've been listening to Jersey Rules, a production of the Assembly Majority Office. If you enjoyed this episode, make sure to subscribe and leave a review wherever you listen to your podcasts. You can find us on Apple Podcasts, Spotify, and YouTube. Thank you for listening.